things rather than what does it do to feel good, what does being Singaporean mean, and so on. Let's start getting into the nitty-gritty.
Okay, thank you. Kai Hong?
Yeah, with your indulgence, I have 3 points. Okay. Your favorite. The first one is to answer the question. There's a difference between healthcare, medical care, and disease care, and we are confusing it all in our discussion. I can tell you this, because they require different types of levers and different financing. You can't hope to finance all of life and all of health, for example, because a lot of it has to come from things outside the healthcare system, your lifestyles, prevention, and all that, for which then you don't confuse it with the medical care financing. Here, we are actually separating medical care financing from healthcare, which includes public health and all that. Okay, having said that, then you don't want to encourage too much of disease care. The way that the 3M is going is actually to pay for hospitalization first, then you're encouraging everybody to hospitalize them because you don't have alternatives. So unless you develop alternative incentives to provide long-term care and all those community-based services, you're asking for trouble. And that's why I was quoted last year saying that we have first world hospital care, but third world long-term care. Right? That's my first point. The second point is private insurance versus social insurance. I think there's no need to argue. The world over has proven that private insurance creates moral hazard and market failures. That's why all over the world have actually gone for compulsory social health insurance. But the problem with social health insurance is that you end up politicizing it. And in the context of an aging society, you think about it, the numbers don't add up. The numbers don't add up. I can tell you the Taiwanese system now has been bankrupt for the last 5 years. It's in the red. Every year they have to keep on tweaking the premiums rate. It's going to get worse and worse with the aging of the population. Where is the money going to come from? From taxes? From the young? Or, I think 10, 20 years from now, you don't want to be Taiwan if you're a young person because you're going to pay a lot more premiums, a lot of taxes, right? So the way to go is actually a mixed system where the basics will have to be more diversified and not a universal, simplistic, one-size-fits-all, single-payer system because it's going to create all the moral hazard and the politicizing of it. I think that's what you want. I think what the Singapore system has done very beautifully, I'm not against this, but they've actually deflected it. They've actually diversified it so that politically I think it's more sustainable. Now, but I'm not so sure about the allocative efficiency. I think the allocative efficiency has now created the perceived inequity. So if we tweak it a little bit more, the more balance, to strengthen the insurance component, I think we can do a better job with the 3M than right now. Why have you saved so much? And after 25 years, 3M is still 15%. I think we should push it and double it, you know. Right? That's my second point. The last point is the point of where do we go from here. I think it's all about balance. You know, it's about trade-off. Do you want to pay more taxes or do you want to pay more premiums so that you can risk pool? That reflects on our values as a society. Do you want to give more money to go into risk pool to pay for somebody else's problem? Or do you want to selfishly hold it to yourself and say money for myself? So it is a trade-off. So what kind of society do you want? Are you prepared to give more money for taxes or to pay more premiums in social health insurance? Let me ask you that question.
Wait, let me ask you a question. If we all agree that it is not fair for 3M to cover only 15% of the total healthcare costs in Singapore, what do you consider to be a fair burden for the government?
Well, I've been chastised by some previous ministers who said, how dare you ask for us to spend more? I said, even WHO recommends 5% for poor countries. Why are we spending 4%? You know, I was actually chastised for this, right? So actually, my reasoning is that you should pack it, and we have done all those calculations for IPS, you know, that with the aging alone, we should push it between 6 to 8%. Of course, the previous minister said, considered finally and said it was 7 to 9%. But we have to keep on tweaking the number as our demand goes up with aging and so on. So is there a level shift? As a consumer, do you want to shift more money and spend it for healthcare, or do you want to save it for other things? So it's a trade-off. So if you think that you want to spend more for more welfare and healthcare, then by all means, it's your choice.
Okay, it's only appropriate that the chairman GPC should have the last word. So, Pin Min, could you share with us some takeaways?
Okay, yeah. Just to answer the part about basic healthcare, I think the definition of basic healthcare actually evolves with time. I mean, just take for example, you know, nowadays, I believe all of us carry a handphone, do we?
Yes.
We all carry a handphone, right? So is this considered a basic necessity? Probably it is. I mean, to think that somebody from the lower income should not carry a handphone is probably not the right thing to think anymore. So similarly, in basic healthcare, I think things have evolved. The expectations of patients have increased. I think we've improved technology. Even sometimes, is CT scan a basic necessity? Is it part of basic healthcare? I would think so. Probably it may be, right? So my take-home message is that we emphasize so much about personal responsibility, and don't go back with the idea that personal responsibility means you spend more money, you cover more of the medical expenses. But in addition to that, I think we have to look after our own health. Okay, make sure that we have lead a healthy lifestyle, medical screening, and then to pick up disease early so that we can get it treated as early as possible. And then to be well informed about some of the medical treatment modalities that are available, rather than to be told by the doctor that this is good, this is bad. You need to read up, find out more about the medical condition so that you are more informed as a patient. I think at the end of the day, the 3M system, the framework is not that bad. Okay, I think we shouldn't just throw the baby out, with the bath water. I think there are things that we can tweak, within the 3M system to make it better.
Thank you. Please join me in thanking our four speakers. Thank you all very much for coming. The next Tembusu Forum will be on the 18th of April. Margaret, on the 18th of April. And it will be a very interesting forum on the tension between artistic freedom and racial harmony. And we will discuss the specific case of a film, a movie called Porn Masala. And the director of the film, Ken Kwek, will be with us. A member of the Film Appeals Committee will be with us. A scholar from the Lee Kuan Yew School who studies Singapore film, Kenneth Paul Tan, will be with us. And a member of the Indian community, Arun Mahitan, will be with us. So until then, thank you all very much for coming.